Hello. Hi, good day to you, and thank you for joining with me. Let me talk to you in my research proposal, the effect of management obstetric emergency role-play simulation on nursing response time. The speed of providing help to patients with emergency cases is a very important element in helping patients in our hospital. Response time or emergency response time is a combination of response time when the patient arrives at the hospital door until the patient gets a response for the emergency department officer with the required service time until the emergency treatment process is complete, 5 minutes. Inadequate staff training was identified as the most common cause of adverse event in obstetric emergency. According to Amadua, there is a plethora of evidence supporting the use of simulation-based training specifically in the management of obstetric emergency. A review of the evidence evaluating the effectiveness of SBT in the management of obstetric emergency is indicated that simulation-based training is associated with improvement in staff skill, patient safety, and quality of care. Live training obstetric emergency are not frequent but require skill and prompt action. Simulation-based training of delivery room team in the management of obstetric emergency could improve clinical performance and reduce incident of medical negligence. There is a problem of failure of response time in the emergency room can be observed from data in the form of die or permanent disability with cases of emergency of vital organ in humans to long day of hospitalization. In the treatment room after assistance, in the emergency room resulting in patient dissatisfaction and complaint up to high treatment costs. According to Health Profile Indonesia 2020, the number of maternal deaths complained from the recording of family health program of the Indonesian Ministry of Health in 2020. So that 4,627 died in Indonesia. This number saw an increase compared to 2019 of 4,221 days. Based on that case, the majority of maternal deaths in 2020 were caused by bleeding as many as 1,330 cases. Hypertension in pregnancy as many as 1,110 cases. And circulatory system disorder as many as 230 cases. This shows that the maternal mortality rate in Indonesia is still high, especially due to an emergency situation. So that's why this study aims to determine the effect of management of obstetric emergency simulation on nursing response time. The research objective to find out the following things that in this research data collection will be carried out in the 2 hospitals, and one hospital will be the intervention group and the other will be the control group. So After that, to spot the response time of nurses after being given treatment in the intervention group and the control group. Of the intervention group will be given training, use a role-play simulation, and will re-simulate every 2 months. The control group will given training in using role-play simulation without re-simulating. And after 6 months, the researcher will assess the nurse's response time. And the last, to seek out the effect of emergency obstetric rule play simulation management on nursing response time. Literature review, management of obstetric emergency. Obstetrical emergency are life-threatening medical conditions that occur in pregnancy or during or after labor and delivery. In the obstetrical emergency of pregnancy, there is ectopic pregnancy, placenta abrasion, placenta previa, preeclampsia, or eclampsia. Obstetrical emergency during labor and delivery, there is ammonia fluid embolism, inversion or rupture of uterus, placenta accreta, prolapse umbilical cord, and the last is shoulder dystocia. For the postpartum hemorrhage, for the obstetrical emergency postpartum, there is postpartum hemorrhage or infection. Role play as a simulation methodology. Role play simulation is an experiential learning method in which either amateur or professional role play improvise with learners as part of a simulated scenario. Roleplay is designed primarily to build first-person experience in a safe and supportive environment. Roleplay is readily acknowledged as a powerful technique across multiple avenues of training. Roleplay simulation engages learned in real-life situation or scenario that can be stressful, unfamiliar, complex, or controversial, requiring them to examine personal feeling toward others and their circumstance. This type of simulation encourages students to think more critically about complex and controversial subjects and to see situations from different perspectives. And the last is response time. Response time is the handling speed calculated when the patient arrives at the hospital until they are treated. It is influenced by several factors according to Gibson performance theory. Response time is the speed of treatment that is calculated when the patient arrives in the hospital. And for response time is categorized with several priority and including P1 or late for emergency patient with a treatment time of 0 minutes. Second is for yellow, and the last for a green. Research methodology for data collection method. I will do will make a research permit to the office, conduct a preliminary survey in the hospital about emergency facility, and the last preparation of module scenario for research data collection. Sample technique using a total sampling technique of nurses in the emergency department out to hospital. One hospital as a control group and the other hospital as the intervention group. For the measuring technique, I will use of a quasi-experimental methodology by design randomized with a control and intervention group and the application of a pre-test and post-test. This study will use quantitative data, the measure of the effect used the independent group to test. For the research question, I will use hypothesis. If the significance value of the test more than 0.05, then H null is accepted and HA is rejected. This means that there is no significant effect of emergency obstetric role play simulation management on nursing response time. If there is significant value of the test less than 0.05, then H null is rejected and HA is accepted. This means that there is a significant effect emergency obstetric role play simulation management on nursing response time. Okay, thank you very much for your attention and have a great day today.